Dr. Allo is an OBGYN who delivers babies at Conway Medical Center. But before a woman even becomes pregnant, in this so-called trimester zero, there are steps she can take and lifestyle changes she can make for a healthier pregnancy.
We all know that pregnancy is divided into three trimesters. The first trimester is from 0 to 13 weeks. The second trimester is from 14 to 27 weeks. And third trimester is from 28 weeks, usually to about 40 weeks. Onto delivery. So trimester zero is that time when a woman is actually considering getting pregnant. So that's a really important time because unfortunately about 50% of pregnancies in the US are unintended, and it's even a smaller percentage of that a woman actually gets ready, if you will, to be pregnant. What I mean by that is this: if she has medical problems, it's very important, let's say she has diabetes or high blood pressure, that she speaks with her physician because her medication may not be compatible with pregnancy. Or the fact that she has to make sure that whether it's that blood pressure or the blood sugar, that they are at the best that they can be in order to get pregnant. And now, the other part for those that do not have any medical issues are those that, where it's very important to take folic acid in the preceding 2-3 months before a woman gets pregnant, or there are actually prenatal vitamins out there that are targeted towards the 3 months before a woman actually becomes pregnant.
So what lifestyle changes should a woman trying to become pregnant make?
A study recently came out that showed that where everyone is really concerned about autism, they did a study on first graders. 1.46% of them had features related to autism. But guess what? It was 5 to 10% had features related to the fetal alcohol syndrome disorders. And, so it's really important that the woman doesn't just get pregnant. Like I said, she has to plan for the pregnancy, give up the smoking, the alcohol, the use of drugs. And there is really no safe amount for alcohol intake. It's just important to stop. And, to exercise, to maintain a good weight. We talk about, yourself after Christmas and everything, everybody wants to lose weight. But for a woman who's trying to get pregnant, it's very important she gets on a healthy diet. And if she needs to lose weight, she does that before she gets pregnant.
Why is regular prenatal care so important?
Moving from trimester zero, the time before a woman gets pregnant, a woman needs to make an appointment with her OBGYN as soon as she's pregnant, because it's very important to get in the first trimester. Very important for dating the pregnancy. What I mean by that is comparing the mom's the due date by the mom's last menstrual period to that by the very first ultrasound. And the ultrasound in the first trimester is the most sensitive for this. It's very important, actually, later on if there are issues with prematurity. It's very important the woman comes in because we do a lot of lab work. We look at her blood work to make sure she's not anemic, doesn't have any other issues going on. When we talk about anemia, everyone is thinking about, I'm going to be tired, or, and can't do this, I sleep a lot. But really, anemia has been linked to depression in pregnancy and also postpartum. It's been linked to the fact that low birth weight in babies can occur. It's been linked to preeclampsia even. So it's very important that a woman makes sure she comes in early. We screen for STDs, give treatments. A lot of women come in even with urinary tract infections, which in itself can predispose to preterm delivery or low birth weight, and they do not know. If they didn't come early, they never would have known they had a urinary tract infection. It helps with monitoring mom's weight gain in pregnancy, making sure it's adequate, that it's not too much, and that it's not too little. Because then, we worry about women gaining weight in pregnancy. On the flip side, there are other women that do not gain good weight in pregnancy. So, helping to prevent those things that are more common in pregnancy, such as pregnancy-induced hypertension, which can lead to preeclampsia, and also preventing gestational diabetes. Sometimes in the patient coming in really early and we're watching the weight gain, we have conversations about diet and, making sure that by the time she gets to the late second trimester, when we're screening for gestational diabetes, she is good. So prenatal care the importance really cannot be overemphasized, both for the mom and for the baby.
Conway Medical Center is working for a baby-friendly designation. What does that mean?
What baby friendly is, it's really promoting breastfeeding. It's with Conway Medical Center, we're working towards officially getting that status. But I can tell you day to day, delivering patients, it's something that, we have that discussion. It starts out in the doctor's office. We have that discussion ahead of time. Conway Hospital has breastfeeding classes, which, I encourage my patients to sign up for. Because, hearing from other people, it's always better to go to the source and to go to people who have looked at studies. Study after study cannot overemphasize the importance of breastfeeding, both to the mom and to the baby. A lot of women are like, I tried. I'm like, it's not just for the baby, it's also for you. Breastfeeding in a woman helps reduce the risk of diabetes later on, even if she did have gestational diabetes in pregnancy. It helps mom lose weight. Mom burns the highest number of calories when she's lactating. It helps protect mom against breast and ovarian cancer. Now going on to the baby, it helps the baby maintain a good weight. It helps keep the baby much healthier. It helps prevent diseases like otitis media, that's infection of the ear. Babies that are breastfed have fewer hospital admissions for illnesses. Premature babies. The way the wonderful breast milk has been designed is to actually be the best for whatever time the baby is born. So when they looked at breast milk for a mom who delivered prematurely, it was different from a mom who delivered full term. So all these things that help keep the mom and baby healthy is why breastfeeding is really promoted.
And what support is offered for breastfeeding mothers?
We do have a lactation consultant available in the hospital. And apart from that, any of the nurses are actually trained to offer support to mom as she is in the hospital. So the lactation consultant usually has a list of those moms that want to breastfeed, and she's already waiting that right after delivery to jump in there and offer that support.